Here we are, Amy. I made it to Park City, Utah. I'm about to go undergo your treatment. Really great to meet you. Welcome to the show.
Thank you.
All right, so let's jump right into it. First off, I love your name, Dr. Amy Killen, and I just have to ask if your friends are like, "You're killing it, Amy." I mean, you must. That's like a constant thing, right?
Yeah. I have a T-shirt that says "Killing It" on there that I wear occasionally.
Okay, good.
So it's a good doctor. It's actually Dr. Amy B. Killen, which is a pretty awesome doctor name. I feel like
that's insane.
It's
which is, by the way, listeners and watchers, that is her Instagram as well.
Yes, that's right, Dr. Amy B. Killen.
Yeah, so you can follow her there. Love it. So you used to be an ER doctor. What led you to get into regenerative medicine?
There's a couple of things. So I did ER for about 10 years. And first of all, it was really hard on me just as a person. You know, you don't sleep. You get up at 3 a.m. to go to work. You eat bad food all day. You know, you're super stressed. And so I kind of started seeing that wear and tear on me. And then I also got frustrated seeing patients coming in that I wasn't feeling like I was helping them. Like they would come in and I would give them, some medicine and send them on their way. And there's no time for, teaching them about lifestyle and teaching them about other alternative ways of living and preventative medicine and things like that. So I felt like I wasn't doing them any service. So I started becoming interested in preventative medicine and integrative medicine and all of the things I do now.
Awesome. Cool. I can see how that environment would be stressful in a number of ways.
Yeah, it definitely is.
Hospitals are stressful just when you walk in. And I think one of the main things is the lighting. That's like we just went upstairs and looked at your new office suites up there. And I was like, oh, my God, there's so much great natural light.
Yeah.
It's like makes the whole thing feel healthier.
Yep.
So what is regenerative medicine? And let's just talk about, I covered with Dr. Harry PRP and stem cells a little bit, but from your perspective, what appealed to you about working with those modalities?
I like the idea of getting your body to heal itself. So sort of giving your body the tools to do that instead of having to take other medications or do surgeries or things like that. I think it gives, for the things I do, a very natural response, natural approach, and it looks nice for skin. So I really like that sort of tricking your own body part of it.
Right. It's less invasive generally than some of the other.
Yes, it's very safe,
treatments.
and you get great results that are lasting. Also, it's not just something that lasts a few hours or a few months, but with the things I do, these things last for years.
So while Dr. Harry focuses on pain and healing injuries, you specialize in skin and sex, which is like way more interesting. I'm like an old man, my sore back. I'm like, let's talk about sex. Okay. Spine, schmine. Let's talk genitals.
Yeah.
So tell us about that. And then we're going to dive a little deeper into those subjects. But what led you into working with stem cells and PRP and all this for those purposes, for beauty and sexual enhancement?
So when I started doing this anti-aging and integrative medicine, I had patients that would come in and say, hey, can you also help with my skin health and make me look more youthful? And or they would say, can you help with my sexual function and make that more better? And so, not more better, but better. So I found that they're actually a similar patient population, the people who wanted help with their skin and their hair, as well as sexual optimization. They're all kind of the same patient population. So, and I also found the treatments that I could use for each of those things. There's a lot of overlap in treatments that were effective for all of them, including stem cells and regenerative medicine, as well as some of the lasers that I do and the other machines that I use. They're actually effective for all those 3 areas. So I found it kind of fascinating, and it's kind of a fun topic. So that's kind of where I landed.
I guess like the obvious thing is people will pay money to improve those things. It's a good business model,
That's true.
It's a sexy business model. So when you inject stem cells into vaginas, what is the purpose of that, and where do you actually inject it?
So the purpose of it depends on the person. Everyone has
And
different
we
goals.
call this the O shot.
The O shot
right?
or the orgasm. The O shot is classically just PRP. So platelet-rich plasma is sort of the person who trademarked it just was doing PRP, which is kind of like stem cell fertilizer, right, from your own blood. But so what I do is I do kind of an O shot like on steroids. It's essentially I call it a turbo O shot, but I use stem cells, I use exosomes, I use PRP. So not just PRP, but also some of the cellular components in there. But as far as where and what it is, we do, it's at least 2 injections. One is the anterior vaginal wall, so kind of the upper part of the vaginal, kind of where the G spot is that we talk about.
I'm familiar, yes. At least I think I am.
Yeah, exactly.
You'd have to ask my exes if I actually am.
So
that's not it. Oh, damn. I thought I was a real stud.
And then the second spot, which you also maybe feel familiar with, is the clitoris. So we do an injection into the clitoris and into the anterior vaginal wall.
Wow.
We numb it first with the topical numbing cream.
Right. So that doesn't require general anesthesia, obviously.
No. You're awake. It's right. It's a 5-minute procedure once we get the stem cells and the PRP. It's actually really easy. It just sounds painful.
And I know. That's why I had to ask that. I was like, God, that just sounds so gnarly. And what are the experiential changes for the patient who gets the O shot? Is there any visual change, like, for a woman that's had a bunch of kids and things are falling apart down there, or a woman that can't have orgasms can now, or stronger or longer or more frequent, or what's the deal with that?
Yeah, it can be all of the above. I've had patients tell me that they have certainly tightening of the tissue, of the vaginal tissue, improved like lubrication, which is a big problem after menopause in a lot of women.
Oh, really? I didn't know that.
The hormonal changes definitely lead to some atrophy of the vaginal tissues. Certainly, I've had people tell me that things look more youthful, and certainly improving orgasm strength as well as just sensations and improving in sensations. And then it also could be helpful for stress urinary incontinence, which is sort of bladder leaking, when you cough or sneeze or run, that a lot of women have and don't talk about. We could also see improvements in that as well.
Wow, fascinating stuff. This is amazing.
I know.
So you could say that generally with the O shot, the overall end result is that women are going to likely enjoy their whole sexual experience more.
Yes, right. I think that's fair.
Right.
That's the idea.
I think it's unfair, actually, because I feel like women already enjoy it more. Like, I've heard men claim they have multiple orgasms and stuff, and I'm like, really, dog? Like, I've not seen empirical evidence of that clearly, but
a lot of women do not enjoy the experience. There's actually, 40% or so of women have some degree of sexual dysfunction. Whether that's lack of sex drive and libido, or whether it's actual problems with orgasm or arousal or other things. But the number is pretty big, and people don't talk about women's dysfunction like they do men's dysfunction.
Because I've never heard of that.
Exactly.
Obviously, subjectively, I don't have that experience being a male, but
it's definitely not talked about.
I would just assume all women are just having multiple orgasms or just living the dream.
That's what men think.
Us guys are the ones that get older and can't get it up and stuff like that.
So that's not the truth.
So 40%.
Yeah, that's not necessarily all the time, and it's different variations in what's causing it, but it's a problem, and one that I think is not researched enough. It's certainly not talked about enough, and people just don't know about it.
And how much of that, this might be outside of evidence or just your intuition or experience, but how much of that female sexual dysfunction do you think is physiological versus psychological trauma, just being disconnected from one's body experience, etc.?
Now that's difficult. I think there's obviously the psychological component is huge for both sexes. Yeah. I think probably more so for women. There's a lot more sort of in the brain kind of like stress and anxiety and, do I look fat today kind of stuff that goes on with women that affects, everything as far as sexual function. So I don't know. I don't know how many.
That's a totally unanswerable question.
It's a hard question. Yeah, it is hard. But
it just popped in my head out of curiosity. I'm like, oh, that's interesting, because I think as a man, I remember being in high school and first experimenting with sex, and I had a few situations in which I got so nervous and caught up in my head that I couldn't perform, and it was like, literally, that's like someone. A murderer or a monster chasing you in the middle of the night. Like, it's just it's the worst fear, the worst scenario ever when you're that young and you don't realize it's not a big deal.
Right.
But then as I got older, that never happened anymore. But I think just because I came.
Yeah, the anxiety part of it is
big.
like
I'm just became comfortable with my body, and I wasn't as worried about like my performance and stuff. But definitely when I was in my teens, it was not a physical phenomenon. There was nothing wrong with my body or my hormones by any stretch. Literally, I would just get in my head and like freak out inside and feel nervous and
But I find that if you can improve some component of the, actual sort of sexual organ system, you can improve the lubrication or the sensitivity or the tightness or for men, the firmness or whatever, that it does feed back to then they have more confidence and they're more interested and their sex drive is higher. So there's this sort of snowball chicken and egg thing that happened. So even
right.
if part of it was just in your head and part of it was structural, if you could fix sort of the structural part of it, then you may also be able to fix the part that's in your head sort of without thinking about it.
It is a loop because
Yeah.
if there's some physiological performance issue, even a slight one as a guy, it can self-perpetuate and then it gets worse
yeah,
because you start
totally.
freaking out about it. And
Absolutely.
obviously, I'm sure it's the same with different issues
Yeah.
sexually for a woman.
Yeah.
Interesting. Interesting stuff. Okay, so then what about, and this is just total left field, but I was curious, have you ever injected a woman's breasts, and would there be any benefit to that aesthetically, you know?
Yeah, there's actually something called the vampire breast lift.
Oh, really?
So the guy, Dr. Runnels, who invented the O shot and the P shot and the vampire facial and facelift, which is PRP for the face, he also has a procedure that he calls the vampire breast lift. This is Dr. Runnels. I haven't done it, but because it involves a large volume of PRP, because it's, usually I'm using like 10 milliliters of platelet-rich plasma.
How many like tablespoons is that, just for a point of reference? Approximately.
It's like a little vial. Like I'm showing it, people can't even. It's maybe, I don't know. I should know.
It's
my
like
conversions.
a syringe full.
It's like a small syringe full.
Okay.
But I have to collect 6 times that much blood to make that much platelet-rich plasma.
Right.
But with the breast lift, you're giving 50 or 60 or 70 or more milliliters of PRP, which means you have to collect a lot more blood. So yes, it's a procedure.
So do they walk out all anemic and like lightheaded?
They're like falling down on their way
They're
out.
like, my breasts look amazing, but I can't walk. Awesome. Okay. And what about, are there any reports of improved like sensation, or is it just something women do?
With the breast lift or with the other. Yeah, I mean, I think it's the same thing that you would experience somewhere else. You'd have improved blood flow, you'd have improved collagen and volume, and PRP has been shown to increase nerve generation in some areas of the body, including the penis. So I suspect that you could increase some of the nerves in the skin as well, although I haven't seen research to that effect.
Right. Okay. Interesting. Because I know some women report that they have very little feeling in their nipples, and then report, like women that I'm like I read reports. Women that
all the studies you've been doing.
Women I've dated, some of them have very sensitive nipples, and some of them not at all, and they're just like, I'm bored, get away from there. So just curious.
Let's move on.
Just curious about that. So this is fun. How does hormone health affect women sexually, and how can it be improved? So aside from the stem cell and PRP and all that, I want to just go a little bit deeper into women's issues in general.
Yeah, I do a lot of hormone work with men and women. And both. And with women, all of their menstrual cycle and all of their sort of sexual desires are tied up in hormonal fluctuations. So we know that during certain times when you have certain types of levels of estrogen and progesterone, testosterone, that's when you're the most interested in having sex, or you're the least interested in having sex. So there's all these fluctuations that affect that just in a normal life. And then certainly as we get older, and by older I mean 35, 40, not that old, you start to have some problems with low levels of certain hormones, like progesterone goes down, testosterone goes down. And one of the side effects is that you maybe don't have as much libido, you don't have as much vaginal lubrication, you don't have, just things change. And certainly postmenopausal women, all the hormones go down and drop way down. And that affects not just your interest in sex, but it also affects the structural integrity of your sexual organs. So you have your vaginal tissues they're not as lubricated, they're not as sensitive, they start to get thinner, you get prone to infection. Like there's all these things that happen that are hormone related that we could help fix by just giving you back hormones. But that's a whole other topic.
As part of your practice, do you do bioidentical hormone replacement?
I do, yeah.
Like that? Oh,
yeah.
Interesting.
I do that for men and women, and it makes a huge difference in people when they need them.
Can you explain? I always just assume everyone knows what I'm talking about when I get nerdy, but can you explain bioidentical hormones versus synthetic hormones?
Yeah, so bioidentical just means the hormones are exactly like the hormones your own body makes. So, if it's testosterone that we're giving you, it's the exact same molecular structure of the testosterone that you already have in your body. So that's all that it means. So basically,
does each person have a unique sort of signature?
No.
Okay.
So your testosterone is just like, Joe's testosterone and whoever else's.
Okay.
But the difference is that if we give you, for instance, you take another non-bioidentical testosterone, it does have some differences structurally. The molecular structure of it's different. And so your body can react differently to it. So maybe it causes liver damage, or maybe it causes, in women, it increases your heart rate, your heart attack risk, or your stroke risk, or your breast cancer risk, or some of the things. With women especially, a lot of the studies that came out years ago that showed that hormones were bad were because they were these pharmaceutical kind of synthetic hormones that were actually causing inflammation because they weren't like the ones they were already in your body. So I only give hormones if they're bioidentical, which means they're just like what we already have.
Wasn't one of the female hormone replacements made from horse urine, like
yes.
mare urine or
yes.
something? Was that
yes.
true? Or
yeah,
wow.
Yeah, that was used. It's still used. It's
really?
Still used.
That doesn't sound safe somehow.
It's not as safe as what other things we can do now.
Wow, interesting. And so if you get bioidentical, if I came and I had low testosterone, I'm like, okay, Amy, I want bioidentical hormone treatment. Where does that actually come from? And is it still synthetic, or is it?
So that's the thing. The word synthetic is the word synthetic versus natural is a little bit, there's kind of misnomers, because the hormones, the bioidentical hormones, they still can be made from, they're still synthesized from something that may not be natural. Sometimes they are, like for instance, progesterone is often made from yams, but not everything has something out in nature that you can distill it from. So they're made in a lab still. Bioidentical hormones are often still made in the lab, but they're still the same hormone that you already have in your body, so you don't have that inflammatory reaction to it.
I see. So essentially science is tricking your body into going, aha, this is from you,
exactly.
but it's actually not.
Exactly.
Okay, cool. And what about diet in terms of how it affects our hormones? And I ask because my hormones have been really good for many years. Especially there was a marked change from the way I used to eat, which is highly inflammatory vegetarian, to becoming, I guess, like bulletproof diet, kind of paleo, and super high fat. And then without changing a lot else in terms of, my movement practice and exercise and all that, my hormones just were vastly improved. So what about diet and lifestyle?
Oh, it's hugely important for everything, obviously, including hormones. We know that, for instance, with testosterone, men who eat a lot of sugar or they're obese don't make nearly as much testosterone. Men who don't get enough branched chain amino acids, who don't get enough vitamin D, who don't get enough protein are not going to make as much testosterone. Fats are really important for both women and men because your hormones are made from cholesterol. So if you're not getting enough good fats in your diet, then it's difficult for you to make your hormones. So these sort of high inflammatory, high carbohydrate, high sugar diets, they wreak havoc on your body in like a million different ways, and hormones are just one of them.
So I'm always curious in terms of providing your body with the building blocks of hormones that a high-fat diet would do. Do you think that plant-based or vegan diet people are compromising their body's ability to be healthy hormonally based on the fact that they're only getting, plant fats, olive oil, coconut oil, et cetera? Or can the body still use those to build the same stuff as animal fat or lard or fish oil or whatever?
Yeah. I think that if the vegan
and I don't mean that in a political sense. I mean just strictly from your scientific point of view.
I think it's certainly possible to be very healthy and hormonally balanced and everything as a vegetarian, as a vegan. It is a little harder to make sure you're getting good quality fats, good quality protein. Now, those are the two things that I see that are problems. A lot of patients that I see that are vegetarian or vegan don't get enough iron, and that's something else that's really important. Like for hair, for instance, there's hair loss is associated with lower iron levels. So there are some things like that they have to be really aware of and make sure that they're targeting their diet to getting those good quality.
Do you run lab tests on people?
Mm-hmm.
Oh, you do? Do you see any difference between like a, toxic standard American diet person who just eats whatever from Costco or I think it's all that food that I try to avoid, and then a really healthy vegetarian or vegan, and then a really healthy, clean food eating like paleo diet person?
I mean, I haven't compared it head to head, but I see trends towards lower inflammatory markers like CRP is one of the ones that we check, which is just a marker of general inflammation in your body. And that level tends to be lower in people who are eating a cleaner diet, less sugar, who are not significantly overweight, who are more active, things like that. And certainly iron, like I said, iron's a big one that I definitely see that's lower in people who are not eating meat.
I've heard that iron in women tends to be low because of menstruation.
Mm-hmm.
Is that true?
That is true. It's not low in everyone, but it's definitely lower in a lot of women. And, just the thing is you have to have a very low iron in order for us to see it in your red blood cell count. So most people are not anemic, which means they have normal red blood cell count. But even if you don't have, if you don't have enough iron, you're going to have problems with hair. You could have problems with hair loss and some things like that are easy to fix by taking a supplement of iron or eating more iron-rich foods.
And then what about for men having too much ferritin from actually having too much iron? Is that an issue? It's another thing that I've heard. Yep. In fact, I go give blood, and I sound like a really horrible person. I don't give blood for the sole purpose of like helping other people that need blood, but I give it to unload some of that iron because I've had some blood work over the years and it's a bit high. I think it was the ferritin. They're like, oh, well, this is too high. Go give blood.
Yeah, ferritin can certainly be high. That's iron. That's the stored iron in your body. And some people have an actual disease where it's high, like hemochromatosis, where it's a disease and you have to give blood. Like it does damage otherwise. And some people just have higher levels, or people who are on taking testosterone, for instance, or just have high testosterone levels will have higher iron levels and higher ferritin levels. So it's probably a good idea if it's too high to get rid of some of that extra blood.
Right. And then when you're administering the bioidentical hormones to bring someone back into balance, what's your preferred method of delivery? I've heard of these pellets you can get put in your hip of testosterone. What are the different ways?
Yeah, I do all of the above. At my clinic, we do all of the above. You can do pellets in men and women, so testosterone, estrogen in pellets, where you put it under the skin. It sits there for 4 to 5 months and then it dissolves slowly. You don't have to think about it, and it's really easy.
Do you feel like a lump in your blood or something?
No, there's no.
Someone's like, that's a weird mole.
It's super easy. It's just like a little office procedure that you could do in 20 minutes. Is it like as big as a
Tic Tac or smaller?
For women it's about Tic Tac size.
Okay. For
men it's like several times a Tic Tac, and you get like 8 of them.
Wow.
So it's a lot more. We kind of fan them out for men, because men, for testosterone, your testosterone levels are 10 times that of women. So we give you 10 times as much testosterone.
Interesting. And how important is testosterone to women? I think as I speak with women, they tend to think that that's like something that's only needed for men. What role does testosterone play in women's health?
It's huge. It's not the primary hormone for women like estrogen is, but it's really important for sex drive, but also for things like being able to form muscle and burn fat, for energy, for motivation. So the same kinds of things that it's important for men, it's important for women.
Oh, cool.
So I give women testosterone all the time.
Right. And also in terms of hormone optimization, are you familiar at all with the use of red light therapy to improve testosterone production?
I am. I am a big fan of red light therapy specifically for skin is what I use it for.
Right.
Because it's great for skin and increasing mitochondrial ATP production and health of skin. But I have also heard some things about using it to increase testosterone. I haven't seen studies that have shown it does that yet. So I'm on the lookout for those. But I know people have used the red light therapy on their genitals and things.
You're sitting in
You're
front
one
of
them. The self-experimenters out there.
I have this thing called the Juve, and it's a big panel. It has near infrared, I think, and mid-infrared, if I'm not mistaken. And it's quite powerful. I mean, like I like to freak people out that come over to record podcasts and stuff. They go, oh, let me see all your biohacking stuff. And I bring them in my little man cave studio, and I flip on that red light. And they're like, it's like really, really bright. But I'll stand in front of that thing naked for 10 minutes, usually twice a day. Sometimes I miss the second one. And I just, make myself busy. I curl weights, or I try to just do something. I
have a good mental picture happening.
Yeah, I tried to do something else productive there. But here's the deal, is that I had my testosterone checked in, I think, 2012 and 2015. It was like in the 300s. It was just tanked early on. That's when I was on a really inflammatory vegetarian diet, unknowingly. And then in 2015, it had gone up to 400, low 400s or something. Then some years went by and my diet improved. I added a lot more fat, got rid of inflammatory foods. I'm out in the sun a lot more, just, generally more health conscious than ever. And then I got it checked after like 3 months of using the Juve, and it was like 870.
Nice.
That was insane.
Yeah.
I'm like, that can't just be from like, oh, now I eat more ghee. I mean, you know what I'm saying? Like it had to have had some effect. But then I got it tested again, and it had leveled out in the 600s or something like that a few weeks later. So it seems, does it fluctuate a lot? It does
fluctuate,
okay.
yeah. It's highest during certain times of the day. Morning, for instance, it's pretty high. Testosterone goes up and down. And really, even a couple of 100 points is not a big variation, in a person.
Okay.
But yeah, I have had patients and people I've talked to on podcasts who have been doing the red light therapy, like you said, but I haven't. I need to do a study and just like get some values before and after, kind of over the period of a few weeks or months, because I think it's possible. I just haven't seen. I haven't seen good evidence
There
yet.
is a bit of data out there. The Juve people, I work with them, and so as an affiliate, and so every time they have a new study, they send it to me so I can check the efficacy before I'm like pitching something to people and talking about it and encouraging other people to buy it without it actually working. But I always forget about the skin benefit too, because I'm in front of that thing a couple times a day. I'm like, yes, that's good.
And nitric oxide is supposed to increase nitric oxide too, which is huge for whole body health, as well as especially for sexual health. That's one of the big players for getting erections and for good sexual health. So there's a lot of good benefits.
Cool. Awesome. Okay, well, good. I'm going to keep on that then. All right, so today you're going to be injecting stem cells into my penis. I want to.
Are you cringing a little bit right now?
I am a bit, yeah. Years ago, I was considering getting a vasectomy. I'm glad I didn't, because now I'm more open to the idea of having kids. I was in my 30s, like, I'm never having kids, bro. I want to do my own thing. And I think as you get older, hopefully you get a little more wise and mature. So I'm glad I didn't. But really the main reason I didn't is just because I couldn't stand the idea of them going around and cutting and snipping down there. Even if I was like under anesthesia, it's just like, God, cut me anywhere but there. Stick a needle anywhere but there. So where's that needle actually going to go?
So the needle, there'll be 5 injections.
Oh my God.
You'll be asleep. You won't even care.
I don't even, it's still terrifying.
A very small needle.
Okay.
There'll be 2 on each side in the corpus cavernosum, which are like I call them the erection tubes, the tubes that fill with blood that are along the top there. So there'll be 2 on each side of those tubes, and then the last one will be kind of toward the tip at the what's called the corona, which is like the ring-shaped kind of part at the base of the glands.
Oh my God. Okay. And I'm hoping, and we're going to get this on film too. So I don't know. We'll have to what they call Greek out, like have that little blurry thing when it shows the bits, but, so that's interesting. And that's the P shot. And then I'm assuming some guys do this without general anesthesia. Did some guys just get numbed and you just go to town?
Yeah, most people do not get general anesthesia. So we just do topical numbing cream, or we can do a nerve block where we put a little numbing at the base and it just numbs the whole thing up.
Oh, interesting, because that's where the blood's coming from?
That's where the nerves come in.
Oh,
so we can block that nerve, and your penis is numb for like 4 hours.
Interesting. That must be a strange feeling. Actually, do you know John Gray, the author, Men Are From Mars? I've interviewed him a couple times. Fascinating guy, but he knows a lot about hormones and relationships and, of course, sex. And on one of the interviews, we were talking about erectile dysfunction and premature ejaculation and some of the issues that men have. And he told me about this. You can get numbing spray and spray it on your penis prior to sex and basically like last forever.
Yeah.
Because it's not, it still feels good, but it's not that sensitive. Yeah. And I was like, it sounds like bullshit. And then I ordered some on Amazon.
You did?
Yeah, I mean, of course, I'm a biohacker. I was like, just in case, I mean, I like sex. If you can make sex better, I'm in,
But was it better or not?
It's pretty amazing.
Okay.
Yeah. I mean, it's not something you would do every time.
Yeah.
But if you're going like marathon status, you're on a weekend getaway and you want to really go to town and, because for a guy, the second one's never as good.
Yeah, yeah.
You can do your little rest period and come back and get back in the game, come off the bench. But you're never as turned on as you were in the first round. So if you can like prolong that first round, it's pretty fantastic. So yeah, having a numb penis isn't necessarily bad. Oh my God, I just remembered something. Back in my former life as a drug user, people used to do that with cocaine. You take a little, a friend of mine told me about it. you take a little cocaine and put it right on the tip, and it kind of goes in the little pee hole a little bit, and then numbs the tip, and effectively does the same thing. But
interesting.
Obviously, that would be illegal. Whereas the numbing spray, it's for tattoos. The numbing spray, you get on Amazon.
Yeah.
You know, so yeah, interesting stuff. Totally,
wow, very interesting.
Total digression there, but I try to provide as much value to the listener as possible.
I appreciate that.
So I'm going to walk out numb. I don't plan on doing anything with my genitals at any point.
Actually,
today.
you will not be numb because you'll be asleep when I do it.
Oh,
so we will have to numb you.
And then it will. Oh, that's right.
So you'll
that's
wake
right.
up just
okay.
totally fine.
Is it going to be sore later?
No.
Really?
Yeah.
Oh, cool.
They won't be sore.
Good. All right. So now what would happen if you inject, would there be any benefit to this? It's just the way my mind works, and I apologize in advance. What would happen if you injected stem cells and or PRP like right into a man's testicle? Would that produce a more abundance of sperm or more, virile sperm, or do anything with that area?
I have no idea. However, there are some studies in women where they have put PRP directly into the ovaries, and for infertility, and actually have in some women they've actually seen an increase in ovulation in those women. These are not things that I do, but I have seen I have seen reference to that in women. So maybe. Cool.
Yeah, I don't know where that came from. It's just the weird stuff my head comes up with. I think that's why people like my show, because it's weird sometimes. Are you married?
Yes.
And have you ever treated your husband with a pee shot?
I have treated him with...
You don't have to answer that.
I have. With all the things that I do, like when I first learned to do them, I bring them home and I'm like, Kyle, I have a new treatment to try. And he's like needle phobic and just in general. So like all my facial injections when I first started doing them, the pee shot, the Gaines wave, all the things I do, he's kind of my guinea pig, and he's never happy about it because he knows that I'm just learning, and I've got like shaky hands, and I'm like, I'm not sure if this is right. And he's always like, what am I doing? But yes, I have done those on him.
Because it seems like that would be something kind of cool for you as the wife to be like, hey, I'm going to practice my work, but maybe actually get a fringe benefit from said husband's improved performance. Interesting. And in terms of the O shot, I'm assuming that as a fan, you've had them administered to yourself as well? I
have had, yes. And in fact, the day I did my training years ago on the O shot, it was a group of doctors. We were all training. And as part of the training, we did each other. I injected that doctor, that person did me. So it was like a group. It was like a group event. It was kind of weird, but yes, I have had it done in the past, and it was great.
Have you ever done it to yourself?
No, I have not. That would be tricky. I feel like just from a getting
anatomically difficult.
I have done my face. I've injected my face with PRP myself several times, and I do microneedling and other. I do a lot of my own sort of aesthetic treatments, but I haven't done the O shot.
It shows you have great skin.
Thank you.
Yeah, so I have the utmost confidence. You mentioned what's that thing, Gaines wave? I heard Ben Greenfield talking about this, and then they randomly sent me an email like, "Hey, you want to take part in our trial and become an affiliate and fly down to Florida?" And I was like, sounds interesting. Honestly, I just didn't want to fly down to Florida. What is Gaines wave?
So Gaines wave is a new way to treat erectile dysfunction, but also just to improve male sexual performance. And basically it's a device that uses sound waves. It's also called low intensity shockwave therapy. It's been used in Europe for about 10 years. It's super easy, non-invasive, not painful, no downtime kind of thing, where we essentially do a series of treatments, usually about 6 treatments over maybe 3 weeks that are like 30 minutes, easy, in and out kind of things, but it increases blood flow in the penis. So it increases blood flow now as well as, in the next few months, and lasts for several years. So you can.
Oh, it lasts that long.
Yeah.
Wow.
So it lasts for a year or two after you do the series. And it's actually one of my favorite things right now. I combine my regenerative treatments like the stem cells and PRP, the P shot with the Gaines wave, with the hormones, and it's like this awesome trifecta of amazingness.
You're like a stud factory over here in Park City.
So Gaines wave is awesome, and it's kind of changing the way that we treat erectile dysfunction, as well as just improving blood flow and function in general.
Wow. Well, it looks like I'll be making another trip out here and spending 6 weeks. So in terms of the pharmaceutical alternatives, drugs like Viagra and Cialis, all of these interventions obviously sound way safer. Are there any widely known side effects to taking those drugs for performance or
in
erectile
general, those
dysfunction?
drugs are pretty safe. They do have side effects, but they're generally not harmful to you. So certainly if you take certain types of medications, like for people who have heart disease and take nitrates or things like that, you don't want to take those medications because they can make your blood pressure go too low. But they're not usually harmful, but they do have known side effects. Like a lot of patients will get headaches, or they'll get vision changes, or they'll get diarrhea or flushing, or or stomach upset, or there's all these things like that that are pretty common in patients who take the medicines that they get right afterwards. It lasts for a few hours.
Yeah, when Viagra first came out years ago, of course, every guy was like, I want to try that, And I did not like it at all. It gave me a headache, made my ears all red, and made my ears ring. It was like not happening at all.
Yeah.
Not a fan.
Yeah.
But that's good to know that it's not known to be like really, really dangerous.
Yeah, for most people.
Yeah. Okay. Cool. Still, I think these interventions sound more interesting and more efficient because they're long term.
They're long term, and you're repairing the damage as
Right.
opposed to just kind of band-aiding it. Like
Right.
you're actually improving the blood flow, which blood flow is almost always the issue with erectile dysfunction. So you're improving the blood flow, and you're improving the sensitivity, and you're improving all the things that are maybe broken.
Right.
You're helping to repair them so that you have improved performance for a long period of time instead of just for 4 hours or whatever.
Right. Yeah, and plus, if it makes your face all red if you take Viagra, then your partner's going to know it's not the real you.
That's true.
Just like you
They're
had
going to be on to you.
Why are you all red after you came out of the bathroom? So in terms of the anti-aging stuff, there's a couple things you're going to do today, and one is dealing with my face. And I do live in Hollywood, so I'm not ashamed of having some degree of vanity left, and I do see myself aging. I'm 47. Sometimes I see a picture, look in the mirror, I'm like, oh my God, I'm like an old guy. This sucks. And then we're also going to be doing some stuff in my scalp, and thank God I haven't lost all my hair, but it's definitely thinning. I'm getting those crow's feet are on your eyes. Widow's Peak, I think it's called, which is, it's like, I'd be cool with, I don't have to be in the greatest shape. I don't need a six pack to be totally ripped, but I'm like, the one thing I would like is to not go totally bald. and no offense to any bald guys listening, I'm sure you just get used to it, but I really think I would look goofy with the bald head. 'Cause once I shaved my head like really, really short, and I was like, yeah, this is not a good look. It was tough for my self-esteem. I'm still identified with the physical a little bit. So what are some of the positive effects of treating skin with stem cells and PRP and the scalp and hair growth and all that?
So, for the skin, the stem cells and PRP can do a lot of things. They can certainly increase blood flow, increase collagen production. So you're kind of like kickstarting your own stem cells that are in your face to become more active. So we're kind of talking to them and saying, hey, you guys are being lazy. You're not cranking out new skin. Let's get you more active. So that's what you're doing by giving these injections. So then now all of a sudden the stem cells in your skin are now making more collagen, which is what gives your face structure. They're making more elastin, which is what gives you that bounce back that young skin has, and more hyaluronic acid, which is what gives your face like the sort of water, has water in it. It's youthful appearing. So a lot of those things you lose with age, starting at like 25. And so we can increase the health of the skin by just increasing those things that are in the skin. And same thing with the hair. Hair follicles, certainly in men, but also in women, certain types of sort of alopecia or baldness, the hair follicles will spend more time in the resting phase than they do in the active growth phase. And as it gets older and older, then you spend more and more time in that resting phase. So what we're trying to do with stem cell therapies and with PRP is we inject around those hair follicles and we stimulate those stem cells and say, hey, let's get back to work. Like we want to have some new hair growth. We don't want to just sit around and get lazy. And so that's kind of the idea. So it's kind of a freshening up of your skin. It can also help prevent some photo damage in your skin, which is kind of interesting. Helps maybe prevent future sun damage.
Oh, cool. Because I'm a huge
in
sun
California.
fan.
Yeah.
I mean, I've never used sunscreen in my life. I don't believe in it. I'm super sun dog, but I'm sure, I'm getting a little oxidative stress from all that exposure.
Yeah. So that's kind of the idea.
I noticed when Dave Asprey came here and did his treatment, after that, his face was noticeably younger.
It really was.
Yeah.
I know.
Like,
I saw him a few months later and I was like, what are you doing, Dave?
I thought it was just Instagram filters, to be honest. At first, I was like, all right, Dave figured out how to use Instagram. Great. And he looks like he's 25. But then I saw him at the Bulletproof conference. I was like, holy crap. He did get younger. I mean, obviously he does. He like me times 100 in terms of biohacks and anti-aging medicine.
Yes.
But Well, I think that really did something. And he's the only one I know that.
Yeah, I treated him twice at a year apart for skin.
Right.
And he does the red light therapy and the this and the that so I think it's probably just all coming together. But yeah, his skin is amazing
Yeah.
now.
And other people I know have commented like, God, that guy looks younger all the time. Like, I know, this stuff works. So what's the actual application? You mentioned microneedling on the face and scalp thing.
Mm-hmm.
Like, how do you actually get them in?
So the first thing I'll do for the face, I actually inject with a needle, like a small 27 gauge needle, and basically hit all the areas that, of the sort of whole face with just under the skin. And then after that, I do microneedling. Microneedling is a little device that has like 10 little bitty needles that just go in about 2 millimeters. So they create these little micro channels, and the microneedling helps induce collagen production on its own. And then when I add topical PRP and stem cells and exosomes and all these things, it kind of there's like these little channels that can get, it's a way for those products to get deeper into the skin when they would have a hard time otherwise. So I essentially am able to treat the skin from kind of underneath the skin as well as from the top of the skin.
Oh, cool. Because the skin has many layers, right?
Right.
Cool. And then what about the scalp? Is there micro there or just needle injections?
So on the scalp, I just do the needle injections. Usually, I may do some microneedling as well, but basically just going into where those hair follicles are, which is not very deep, and injecting the PRP and stem cells into that area is all we need to do.
Am I going to be all red like I had a laser peel tomorrow?
You will be red today.
Okay.
If you film anything later on today, you'll be red.
No, I'm not.
But and a little swollen because I'm going to be putting fluid, in your face.
Yeah.
But by tomorrow, you'll be pink and it'll look like a sunburn. You can just play it off like you were, at the beach.
And is it possible that this will help mitigate some of the dark circles that I have?
Yes. In fact, PRP and stem cells are both really nice for dark circles because it can thicken that skin a little bit. That's, the skin gets thinner as we get older around the eyes. So it can thicken that skin a little bit. And also part of the reason for dark circles is that the capillaries are leaking and you can kind of you can see that capillary leak. And by putting these things in that area, it seems to help with that leaking as well.
Awesome. Yeah, that's one thing. Like when I'm doing my little Instagram filters, I always try to take that out.
No, I'm the
I
same
don't want
way.
them to look too fake, but I'm like, God, it's my Italian heritage.
Yes.
Damn it.
I've had dark circles my whole life. As a kid, people
Really?
People always ask me, "Why are you sleep deprived?"
Right.
And I was like, "No, I just
I mean,
have dark
honestly, I
circles."
did spend a good 20 years of my life very sleep deprived, so it makes sense. Okay, so last question is, well, second to the last, what's the weirdest thing that's ever happened during a sex organ procedure?
I don't have a lot of weird things that happen during the procedure. I have had some funny stories that have happened after the procedure. Like I always give my male patients a penis pump to take home with them after their
Do I get one
procedure.
of those?
You do.
Amazing.
You do. I know.
That's great.
So
I'm going to Instagram live that. Just kidding.
And the pump that I used to use it was like a hand pump, and it had this like gun-shaped pump part of the hand pump part was like a gun-shaped part thing. And so one of my patients took the pump and put it in his carry-on bag. And as he was going through security at the airport, the TSA pulls him aside and they were like, takes out the pump and unwraps the pump and is like holding it up and over the big AV system.
That's totally
what
happening to me because
Yeah.
I carry all this biohacking tech, lasers and freaking hydrogen machine and biomed and all this stuff. So they always rifle through my stuff. So I'll look forward to that.
Yeah. So that was luckily this guy was kind of a badass, and he was like, I don't care, bring out my pump.
And what's the purpose of the pump?
So the pumping is really nice as a standalone, but especially after procedures, it increases blood flow and oxygenation, and can really help with erection firmness and staying power, and even increase size in some people. So I recommend it for after I know.
Sign me up. Give me
Why
two.
are we doing this already?
And why am I just finding out about this
I know,
today?
Exactly.
Okay, well, that's a great story. I love that. And then very last question would be, who are 3 teachers or teachings that you could recommend? It could be a book, it could be a doctor you study under, it could be a philosophy, anything, just things that have motivated you that our audience might benefit from going and looking up.
Oh, that's a hard one. I should have prepared for this since you just
That's
asked
the whole
Dr.
idea.
Adelson this. So one of my sort of mentors that I learned a lot of this PRP stuff was a doctor named Elizabeth Roy, who I'm still a big fan of, and she's taught me a lot of these procedures back years ago when they were first coming out, and I still kind of try to stay in touch with her and a big fan of her. And she actually practices in Florida, so if you're ever out there, she's great. As far as I really like the book "Come as You Are." It's a book by a a physician. She's a doctor, not a physician, but Emily Nagari, who is it's like a sex therapist physician who writes a lot about women's sexual health. And I just read that, and that was really, I think, really good for women to read. It's kind of about how to embracing that you are normal, even if you don't feel like you are, and kind of walks through a lot of the sexual kind of problems that women have.
That's great, because as you said, there's a lack of awareness. I mean, I think us guys think, we're the ones with all the problems in that area, so that's cool. And we have a lot of female listeners to the show too. So
so that's a good book. I've been like on a sex book rampage recently. My Kindle, my app is full. My husband's like, "What are you doing?" There's always there's tons of these books, but that was a good one. And then other mentors. Really, the only other support I would say is my family has been really supportive. My husband, when I left the ER 5 years ago and had no job and I had no income, and I was just like, yeah, I'm going to do this other stuff. And he was like, okay, right on. Just do it like that. Do whatever makes you happy. And that has been, a huge thing for me to be able to go out and experiment and learn new things and then bring them back and try them and say, and see if they work or not, which is
little
what I like
did he know you're going to be showing up with a needle and trying to stick him.
Right. And then talking about it on the podcast. Yeah, exactly.
That's awesome. All right. Well, thank you so much for your time. And I'll look forward to you poking and prodding me while I'm asleep in the next few minutes.
Awesome. I'll look forward to it too.
Oh, one last thing I almost forgot. We're here in Storey Clinic, so that's one URL. Do you have any other social media or websites you want to send people to?
Yeah, so Storey Clinics is kind of the website that has just the musculoskeletal stuff. My version of it is Storey Medical, so DOCERE medical.com. And then I have my own social media through Dr. Amy B. Killen, Instagram, Facebook, Twitter.
Dr. Amy B. Killen.
All of those things. Yeah, exactly.
Okay, awesome. We'll put all of that in the show notes. Thanks again for joining me today.
Thank you so much.